Hello and welcome, incoming WashU students and their families. My name is Elizabeth Sullivan with the Division of Student Success, and I want to welcome you to our family webinar series. I'm joined by Dr. Cherie LeBlanc, Executive Director of the Student Health Center on the Danforth campus, and Dr. John Dunkel, Interim Director for the Center for Counseling and Psychological Services. Thank you for joining us on this conversation about health and well-being. I'm going to turn it over to Doctors LeBlanc and Dunkel so they can give us an overview of their center's resources and services.
Well, hi, everyone. As Elizabeth said, I'm Cherie LeBlanc. I serve as the Executive Director of the Student Health Center here on the Danforth campus. And I'm going to start off by reviewing some general information that applies to both the Student Health Center and the Center for Counseling and Psychological Services, or CCPS. Then I'll dive into more detail about our medical, psychiatric, and health promotion services. Next, I'll address requirements that are necessary for our incoming students, and then turn it over to my colleague, Dr. John Dunkel, who will review counseling and psychological services. We provide comprehensive and integrated care, including medical, psychiatric, counseling, and health promotion services. CCPS and Student Health share space in the basement of Dardick House, which is a residence hall on the South 40. CCPS has several other locations on campus as well. We're open Monday through Friday, most days from 8 to 5, except on Wednesdays when we open at 10 because of staff meetings in the mornings. Our after-hour support for both services is provided by Timely Care through telehealth and telemental health services. And I believe John will discuss Timely Care later on in the presentation. Medical services provides both routine preventative care as well as urgent medical care, reproductive health care, sports medicine, travel medicine, and psychiatry. Our physicians are on faculty at the School of Medicine, and they're board certified either in internal medicine, family medicine, adolescent medicine, psychiatry, as well as travel and sports medicine. And some of our providers have double and triple certifications. We have nurse practitioners as well as physician assistants, registered nurses, and certified medical assistants, all here who work in a team to take care of your students. As you can see, we have a comprehensive healthcare team. We consider ourselves the primary care providers for all WashU students. We have radiology suite for x-rays. We have a full lab with on-site testing for things like mono, strep, flu, COVID, urinalysis, some gynecological tests. We also have LabCorp, which is our reference lab, and they have staff here at the health center who can draw blood and to be sent off for any other kind of blood test that's needed. If students need care from specialists that are not within our purview, we work really closely with our colleagues on the medical school campus and refer out when needed. Health Promotion Services creates a campus culture in which health and well-being are intentionally embedded throughout campus. They improve students' health, reduce risk, and build healthy decision-making skills through health education. They offer outreach programs, workshops, class presentations, and training opportunities for the university community. And these are led by our staff members, graduate student assistants, and undergraduate peer health educators. Located in the Summers Rec Center near the main entrance is the Zenker Wellness Suite, the health promotion hub for the Student Health Center. It's open from 10 to 6 Monday through Friday during the fall and spring semesters. Zenker is a welcoming space staffed by graduate students and featuring health promotion resources on key topics for undergraduate and graduate students. It's a fun place to stop by with free giveaways, handouts, snacks, and other supplies. Now here I'm going to address the university healthcare requirements that need to be met before coming to WashU. The first is immunizations. 2 MMRs or measles, mumps, rubella vaccines are required after the age of 1. A meningococcal vaccine is required after the 16th birthday. This particular vaccine provides protection for about 4 years, and to be protected during their entire tenure here at WashU, students need that vaccine after the age of 16. Most children receive the first dose of this vaccine at the age of 11 or 12, and then the second dose at age 16. We also highly recommend the meningitis B vaccine. This is a different vaccine than the meningococcal vaccine I just discussed. This is important because most of the meningococcal outbreaks in college are caused by meningitis B. So if your child hasn't had the meningitis B vaccine, talk to your pediatrician before coming and think about getting that vaccine as well. It's also available here, and we're happy to provide that immunization. All students must also fill out a TB screening form. If based on the answers to those questions, we feel that they may be at high risk of exposure to tuberculosis, we'll also require that a TB test is done within 6 months of matriculation. The other requirement is that students must have health insurance, and as such, all students are enrolled in the student health insurance plan, with an option to waive out of the school's insurance if your own insurance meets waiver criteria, and this can be found on our website. The waiver period is from July 1st through September 5th each year. Once a student is registered, the student health insurance premium is applied to their account, and if your plan meets waiver criteria and is approved, the premium is then removed from the student account. Okay, John, I'm going to send it over to you.
Okay, thank you, Dr. LeBlanc. As I said earlier, my name is John Dunkel. I'm the interim director of the Center for Counseling and Psychological Services here at WashU. I'm going to say a little bit about what CCPS, also known as, what we offer to our students. The bread and butter of our services are counseling and case management. So we have staff who consist of licensed psychologists, licensed professional counselors, licensed clinical social workers. We also have what's called a care manager who usually supports students in accessing services, particularly if they're going to need services off campus or in the community somewhere. We do have a sort of scope of services that I'll explain in just a minute, where a referral to off campus is necessary for some students. We also have an urgent care counselor who's available when we are open during business hours that Dr. LeBlanc mentioned earlier, who can see students who would like to be seen for a more emergent meeting during the day. So we have an interdisciplinary team of licensed mental health professionals who really are passionate about the work that they do with students. The services that we offer, as I mentioned, our scope of services really is we focus on short-term individual counseling. We do some couples counseling when requested, but we see students on a weekly, usually every other week basis, depending upon need. And we also do group counseling. Group counseling is an area that we've really expanded in recent years, and we're really excited about it. This semester, we're offering 14 groups, and they're both psychoeducational and therapeutic groups. And students who at first might be reluctant to enter into group therapy, but once they do and they learn about what it is, they really get a lot out of it. I'm a big proponent of group therapy, so in group counseling. So I like to mention it as another part of our services. We also have something called Let's Talk, where we have some of our staff who do some hours across different locations on campus, because we know sometimes students may not necessarily want to come through our doors as a first step. And so it's a place where they can go meet with one of our staff members. It's a confidential consultation to decide, sort of what they might be needing. It sometimes means they get an appointment with our office. Sometimes it means that's all that they need, and they may come back at some point. But it's really an opportunity to be out in the community so students can meet us where they feel most comfortable. The other big component of what we do a lot of crisis response. So if there's a student who's in crisis or an urgent matter, we try to provide services. We'll meet with the student, and even we'll talk with different types of people who might be concerned about a student. So that I'm going to jump down now to the last bullet there. We do a lot of consultation with campus community members and families. I think they will call us and have concerns about a student, and we will help them walk through sort of what's going on, what are the best steps for them to take to get the student support. So we do provide a lot of consultation to community members, and we will often get parents and other family members, faculty, other staff, other students who will call or reach out to us in some way because they were concerned about a student. Also, as I mentioned earlier, we will, when appropriate, we will provide referrals to off-campus services because perhaps a student needs a higher level of care, a more intensive form of care that we cannot provide. And so we will work, our care manager will work really hard to help students navigate the different options off campus and insurance issues. One thing I will say about the insurance that Dr. LeBlanc mentioned earlier, as she said, you have an opportunity to waive out. The one thing I always recommend to families is as they make that decision, really check to see what your family's insurance will cover in the St. Louis area. And it's particularly important, well, it's important for all healthcare, but I know that with mental health, it's even more tricky sometimes. So really understand what your insurance covers as you're making that decision to waive out of the student health insurance plan. As we mentioned earlier, the university has purchased an app called Timely Care, which is something that students can download and have on their phone and can have access to mental health services pretty much 24 hours a day. They can do scheduled appointments. They can also, if in the middle of the night they need to talk to somebody, they can reach out and do a phone or a video appointment with mental health professionals on the other line. They have to download the app, as I said, and this QR code there is something they can use with their phone, download it, and they can register with their WashU email address, and they can do all that registration. It's really important that students do this in the beginning, before the academic year starts, so that if they ever need it, they don't have to, if they're in the middle of the night, for example, and they're feeling that they need to talk to somebody, they don't have to worry about, oh, I have to download the app, I have to register. If they have it downloaded ahead of time, they can just go in, set up an appointment. They can even sort of decide if they want phone or video, and then they can have the session at whatever time of day it is. So this Timely Care app is really important. They can also do, if their schedule doesn't align necessarily with the CCPS schedule, and or they would like to have a therapist with other types of, backgrounds, credentials, etc., they can even do scheduled counseling through Timely Care. And even the Timely Care will offer evenings and even weekend hours for some students who prefer that. But it's all done through video so that they have options for themselves for different types of services. So that's Timely Care. Download it as soon as the student receives their WashU email address. The other thing that we've also partnered with is something called Thriving Campus. So if a student would prefer to just find a provider or a family member would like to, they could go to this Thriving Campus website and just select and browse by different filters for different types of therapists in the St. Louis area, for example. It may be depending upon what needs you have as a student, what you're looking for, different other preferences, maybe demographics. And they will give a list of community providers to connect with based on the search that the student does. So it's free of charge. And I wanted to say that all of our services are free of charge. The counseling services are free for the first 9 sessions. After 9 sessions, what happens is that we will bill insurance, and there will often be a copay that students will have to pay, which will be charged to them. But I want to make sure that I mentioned about the payment, that the first 9 sessions are free, and there's a copay after that typically.
Great. Thank you both for that great information. I'd like to move on to a couple of frequently asked questions. So the first question I have for you both today is, if you don't mind, could you please elaborate a little bit more on the student health insurance plan and waiver criteria? And if students do want to waive out of the student health insurance plan, can they still be seen at the health center?
I think I'll take that one if that's okay. So I'll answer the last one first. Students who've waived out absolutely can be seen and are most welcome. We'll bill the outside insurance plan in a similar way that they've, have been billed whenever you visit an outside care facility. And of course, on the CCPS side, these students are students and they will have those 9 sessions without worry. And then again, it would be billed to their insurance in that way. The student health insurance plan, if I wanted to talk about some specifics, is a very comprehensive plan. We follow ACA guidelines, and you can find the details of the benefits of the plan on our website. And I'd encourage you, as Dr. Dunkel had already said, to spend some time there reviewing it and comparing it to what your plan covers. The waiver criteria is also pretty clearly laid out on our website, but in short, your plan needs to be a US-based plan. It needs to cover your student for all care here in St. Louis, not just for emergency care. So that includes routine preventative care, specialty care, inpatient, outpatient, mental health care, and it also needs to have a prescription drug benefit. We're not Medicaid providers, so it can't be a Medicaid plan, though there are exceptions for Missouri Medicaid on a case-by-case basis. If care has already been established with Medicaid providers here in St. Louis, then we're happy that, that person is being taken care of by local providers. We won't be seeing them because we don't take that insurance, but it is done on a case-by-case basis. And all of this is important because we want to be sure that students are covered, that they can be seen quickly, either by us or people in the community, that we can take care of any of their health needs before it becomes a crisis and creates further problems for them that can significantly impact their ability to continue their studies.
Thank you for that information. Dr. Dunkel, what should a student do if they need mental health services when CCPS is closed?
Very good question, and I think that's where the Timely Care app that I was mentioning earlier, they have a sort of program in I don't know if program's the right word, service within Timely Care called Talk Now, and that's why it's important that the students have this downloaded in the very beginning. Talk Now is a place where students can go in, schedule an appointment in the middle of the night if they want to. They can do a video or phone, and they can talk to, and they usually can get it within like 2 or 3 minutes of making the appointment. And they can speak with a mental health professional at any time of day. And so Talk Now is really what we direct students to. If it is something that they're in an emergency and if they're in imminent danger, they should be calling like 911 or the Washington University Police.
Will parents or family members be notified when a student is seen at the health center?
No, and before I go into that, I'm going to just also play off of Dr. Dunkel's answer about after hours. Certainly, Washington University has what's called an emergency response team, or they're called EST for short, and emergency support team. And calling WashU Police Department will be a co-dispatch for our EST members. And again, in an emergency, if something is urgent, this is amazing for students that they can get access to emergency care on campus. Decision can be made if they need to be transferred to a hospital in the middle of the night and so on. But that is, again, really an important service for when we're closed. And now I'll talk about whether or not you're going to know about your student coming to see us. So no, you're not if they are over the age of 18. We are bound by HIPAA, and that we take that very seriously. under 18, and we do have quite a few incoming students who are 17 when they join us, may turn 18 later in the year. But so during that time when they are under 18, we will be calling every time we see a student to get permission to treat them. But once that magic happens at the age of 18, we won't be speaking to anyone without the student's permission, except in the case of an emergency. I will say in the office, if we evaluate a patient and determine they need to go to the emergency room, we're having a conversation with them at that time and offering to call you and explain what's happening. And certainly if they are incapacitated and unable to give permission, we or the Dean of Students office is calling you, notifying families of this type of an emergency. I'll also say there are many times when I walk into the exam room and you're on the end of that speakerphone. And we're very happy to partner with you. But again, once they're 18, that needs to be the student's initiative to do that. And we guard HIPAA so fiercely because as you think about it, during this developmental stage, students are sprouting their wings. They're looking at individuation. They're exploring all kinds of things. And we want to be the expert that they can come to with questions or issues and not be concerned that somehow this information is going to get back to faculty or get back to parents or family members if they're not quite ready to share this information at that time.
What would happen if a student experiences a mental health emergency and needs to be hospitalized? And what would you recommend a family member does if they know their student is experiencing an emergency?
So I think if there's an emergency, well, first of all, if a student needs to be sent to the hospital, we will make sure make sure they get there, and make sure that they get to the emergency room, and then the emergency room will then do their evaluation. Their staff will do the evaluation to determine if a student actually needs to be hospitalized. If a parent is worried or a family member is worried about a student, I say call and consult, whether you call my office or, matter of fact, I took 2 calls just this morning from people who were worried about their student, and I walked through some options for them in terms of getting them support. If it's a true emergency, they really should be calling like either 911 or our Washington University Police if it's a true emergency. We also have an office called WashU Cares, which families will hear about as their students as they get more familiar with WashU. WashU Cares is an office that we work very closely with, who will oftentimes be other resources for families if a student is needing to be hospitalized, and especially when they're being discharged. So definitely they should call. They should, if they're worried about their student imminently, then they really should be calling the emergency resources like 911 or WashU PD. And they're very good at getting the students to local hospitals.
Well, thank you, Dr. LeBlanc and Dr. Dunkel, for the really helpful and informative information you shared. Parents and families, we hope you found this video informative and enjoy the rest of the family webinar series. Thank you, everybody.